A newly released workplace survey of more than 11,000 nurses found more than half said they are stressed, frustrated, exhausted, and overwhelmed. A record number of healthcare workers left their jobs during the pandemic.
We do have a staffing crisis.
Katie Boston Leary is a nurse with almost 30 years of experience. She's now the director of nursing programs for the American Nurses Association.
How is this nursing staffing shortage affecting patients?
Oh, it's a public health issue. We're seeing a slow deterioration of how care is delivered. You're seeing services that are being temporarily suspended because they don't have nurses to cover units.
But an app, ShiftMed, is helping to alleviate some of those staffing shortages. It connects screened and verified medical professionals with temporary jobs.
They're a leader in a growing industry of app-based work for medical professionals. Jessica Constantine's workday starts like this, on her phone, looking for a shift to pick up. She's a certified nursing assistant who works when she wants and where she wants using ShiftMed.
I'm a mother as well, so I can look on the app and pick whatever I like and match it with my kid's schedule.
Jessica started working full-time with ShiftMed in March after years working a traditional schedule. She says she gets paid the same, sometimes more, through the app, and it's a lot more flexible.
I can work 16 hours on Sunday, I can work 16 hours on Saturday, work 8 hours on Monday, and I'm done. Hi, Jessica from ShiftMed.
Today she's working at Insight Memory Care, a facility in Fairfax, Virginia that specializes in patients with Alzheimer's.
Let me walk you around a little bit.
This is her first time at the facility, so it begins with an orientation.
This is the nurse's station.
She's quickly up to speed and helping the patients.
It's 117 over 77. You go, girl.
She says gigs where she gets to work with the elderly are her favorite.
What are you reading today?
Daily Chronicle.
Morning, Patricia.
As the executive director for Insight Memory Care, Anita Irvin is Jessica's boss for the day.
Good job, buddy.
She says the staffing flexibility from this service helped them stay open during the pandemic.
Even if it was like at 5 o'clock that afternoon and I needed somebody the next morning, they were able to fill that last-minute gap for me.
ShiftMed also connects home healthcare aides like Travis Graham with patients outside of a nursing home or hospital. Today, Travis is at the home of Kate Partain.
The fresh air is wonderful.
Because of a stroke, she needs daily assistance with medical care and basic tasks.
Here you are.
Oh, yay. Thank you.
You're welcome.
Travis logs in every morning and chooses his shift.
You can work where you want, when you want, what state you want, how many hours you want.
And for Kate, it means having someone there every day, even when Travis takes a day off.
How are these technologies helping with this crisis?
Well, it does help. It's one tool that does help with some of the situations that nurses have because nurses more than ever want to determine when they work and where they're working.
Boston Leary says anything that gives nurses flexibility and, most importantly, an incentive to stay in the industry is a positive. But she warns this doesn't solve the underlying problem.
It does create a stopgap, but it's not a long-term fix. We have to look at the pipeline versus looking at tools to move nurses around because it is a rock Peter to pay Paul situation.
So, Vic, how much does it cost these hospitals to actually bring in a ShiftMed employee?
So it depends on the market and what's happening, the demand there. But hospitals are really trying to be competitive so they can attract the best nurses and nursing professionals. In some cases, they'll actually even pay for the rideshare to try to get you there. It does make it more difficult for hospitals in rural areas because they can't be as competitive. But as they expand, they're in 23 states now. As they get to 50 states, hopefully by the end of the year, you'll start to see the demand and the competition rise.
I love a creative solution to a problem.
Absolutely.
It's cool.
And using technology, it really helps.
Good concept. Thanks,
Thank you,
Vic.
Vicky.
Thank you.